In every corner of America, businesses are deeply struggling to find enough workers and resume normal operations. In the entire history of the United States, we've never seen such a persistent shortage of labor. With each passing day, more disruptions caused by this nationwide staffing shortfall are being reported. Most employers say that they have never experienced anything like this before. In fact, not very long ago, we had a chronic unemployment problem that stretched back for decades. Economists used to insist that our economy would never be able to generate enough jobs for everyone, but that turned out to be wrong. There are currently more than 10 million open positions all around the nation, and employers are scrambling to attract people back to the workforce. The competition for workers has become so extreme that even bidding wars are being reported, while some companies are offering sizable bonuses, expensive gifts, college tuition, and even trips to their new employees. Despite these efforts, people continue to leave their jobs at a record rate. According to the Bureau of Labor Statistics, 4.5 million Americans voluntarily left their jobs in November, which has pushed the quits rate to 3%, matching the high from September. The report also highlighted that workers in the hospitality industry had the highest quits rate at 6.1%, and those in healthcare, transportation, warehouse work, and utilities came just behind. Workers continue to quit their jobs at a historic rate. The low-wage sectors directly impacted by the health crisis continued to be the source of much of the elevated quitting, explained Nick Bunker, the director of research at the Indeed Hiring Lab. Industry analysts expect this dynamic to persist during the whole year of 2022, especially considering the new wave of virus cases. In recent months, the conditions in the labor market have become so critical that business closures related to severe staffing losses are being reported on an almost daily basis, with small businesses being particularly hard hit. Small and medium-sized businesses typically operate on remarkably thin margins, so they can't afford to offer competitive wages all of a sudden. In Nebraska, one restaurant that's been in business for the past 46 years in the city of Waverly is being forced to close for good since it can't find enough staffers. Jim Wilkinson, the owner of Honey Creek Dining, revealed that for most of the last 46 years, his restaurant was typically well-stocked with about 20 cooks and servers, but the staff has significantly thinned out amid this unprecedented labor shortage gripping the industry and threatening the economy. A couple of weeks ago, Wilkinson and his wife, Kathy, decided to close the restaurant after a nearly 5-decade run because they simply can't find enough people to work for them. That was the final straw, he stressed. Hundreds of thousands of other small and medium-sized businesses find themselves in the same situation. Zoe Olson, the executive director of the Nebraska Restaurant Association, notes that the problem is a confluence of many factors, from workers' health concerns to the lack of childcare amid the gathering restrictions, just to name a few. It's a perfect storm, Olson said, and it's affecting all sectors of the economy, not only restaurants, from suppliers to truck drivers, he added. Of course, it isn't just small businesses that are suffering. At this stage of the crisis, even some of the biggest corporations in the country can't find enough workers. Last month, many consumers were shocked to learn that Apple has closed every single one of their stores in New York due to a staffing shortage, as the new variant spreads around the state and has led companies to implement their own lockdowns. New York City remains the epicenter for the third wave of the virus in the U.S. That's why the tech giant decided to close down its stores in Soho, the Upper West Side, Chelsea, Brooklyn, Staten Island, and the Bronx. Long Island shops in Huntington Station and Manhasset were also affected. Apple also announced the closure of shops in Los Angeles Tower Theater, Carnegie Library in Washington, D.C., and outlets in Ohio, Texas, Georgia, and Florida. All around the nation, public-facing businesses are going through yet another wave of shutdowns as employers quit their jobs amid the worsening health crisis. In Austin, Texas, the incredibly popular Franklin Barbecue and more than a dozen other bars and restaurants shut down because staffers were fearing infections, according to ETA. What's even more worrying is that there are other institutions where a lack of workers can literally put the lives of thousands of people in danger. Right now, hospitals are severely struggling with a critical staff shortage, and many facilities had to permanently or temporarily halt some services. A new report by Becker cites a few examples of facilities that are either closing or reducing services this year. Advocate Aurora announced the shutdown of 3 urgent care facilities at the end of December. Managing the new virus surge combined with staffing shortages have contributed to closures at our urgent care centers in Menominee Falls, Brookfield, and on River Center Drive in Milwaukee, the system said in a statement. The National Institute of Health is postponing surgeries as a number of employees have left their jobs or have been calling in sick since December 29th. The situation has gotten a little bit worse each day, Dr. James Gilman wrote. If there is any good news, it may be that the peak should be rapid and we can get back to business as usual soon. However, we cannot do business as usual right now. In Indiana, the Pulaski Memorial Hospital in Wenhamac suspended all maternity services. In a press release shared with the local news station, Tom Barry, the hospital's CEO, said that the hospital has had significant difficulty recruiting additional staff to our OB maternity unit in order to maintain the high-quality standards that all patients deserve and expect from PMH. He added that the healthcare labor shortage, exacerbated by the virus health crisis, has affected the availability of maternity nurses. Meanwhile, in Massachusetts, a new study found that in the last 10 months of 2021, at least 154 additional mental beds were reported as taken offline solely because of staffing shortages. Nearly all facilities, or about 96%, also reported shortages in registered nurses, and 78% reported shortages in mental health workers. In Illinois, Mercy Health applied to end inpatient care at a local hospital. The health system said it will suspend all inpatient services at its Rockford-based hospital starting this month, adding that the discontinuation of inpatient care is necessary after it saw decreased emergency department and surgery volume amid the health crisis. It also mentioned a nursing shortage. Given the severe nursing and healthcare staffing shortages right now, it doesn't make sense to continue down our current course, Mercy Health President and CEO Javon Beer said in a recent note. Prior to 2020, this sort of thing didn't happen. We always had more than enough workers, and we might have taken that leverage for granted. The truth is that we have lost millions of people over the past 2 years, and to make things worse, many are now incapacitated as they've developed serious heart conditions. With the number of available workers drastically reduced, many businesses are starting to come up with very creative alternatives to stay afloat. For instance, in California, some hotels are now utilizing robots. As the hospitality industry faces mounting pressure to provide attentive service in Silicon Valley, robots are filling the gap left by workers. Even though that may sound strange, industry executives say that this is where things are headed now. If you stay at the Radisson in Sunnyvale, a robot may take and deliver your order to your door. A guest would like a soft drink delivered to the room. In the past, someone from the front desk or sometimes even the general manager might step up. Now, this robot, designed by Savioke and Campbell, will handle the task, a local report described. They're in this kind of crunch mode where the higher-paid staff are filling in for things that, frankly, robots can do, explained Savioke CEO Steve Cousins. And there are many advantages to using robots for everyday services. According to Cousins, the robot only needs to be trained once to be able to navigate the lobby and hallways, and it's even adapted to call for an elevator and press the destination floor. This trend is just the beginning. One CNN report estimated that by 2030, robots could have taken over 20 million manufacturing jobs around the world. A new study released by Oxford Economics revealed that within the next 11 years, there could be 14 million robots put to work in China alone. By analyzing long-term trends related to the uptake of automation in the workplace, Economist also discovered that over the past 2 decades, the number of robots in use worldwide increased threefold to 2.25 million. And although the rise of robots will bring about the benefits in terms of productivity and economic growth, researchers also acknowledge the drawbacks that are expected to arise simultaneously. The authors wrote, "As a result of robotization, tens of millions of jobs will be lost. This will therefore translate to an increase in income inequality. Perhaps that has been the plan of the elites all along. Unfortunately, when the economy starts sliding and people try to come back to these jobs, well, they won't be there anymore." Our world is rapidly becoming an extremely bizarre place, and it's safe to say that things will soon become even weirder. Those who are still waiting for things to come back to normal can stop waiting because it's simply not going to happen. As technology advances, our society will continue to be transformed at a breathtaking pace, and we must be ready to face a different world as global events accelerate even further as we hurtle through the early stages of 2022. Thank you very much for watching.